and welcome back to another exciting video from FE Aspire, where we talk about stories of grit and resilience, of success and failures of entrepreneurs in the MSME ecosystem. Today, we have with us two very successful entrepreneurs, Rahul Rastogi and Neha Rastogi, founders of Agatsa, which has innovated the world's first pocket ECG device used by doctors and heart patients in India to address cardiac related issues, which is probably among the leading causes of death globally. Thanks, Rahul, Neha. Thanks for joining us. And so we'll begin with trying to understand what the background that you come from, how you got into entrepreneurship, and why only something something as niche as an ECGC device maker. How you got into this, and from where do you see this going? Let's say next 5 years.
Thank you, Sandeep. So basically, we both come from a normal middle class background, and we are first generation entrepreneurs. Our parents were in job, and we also started with working. So we did engineering basically. We are electronics engineer, and we started working for different companies, which include companies for Neha. They include companies like Xerox, Hewitt, and CSC, which are more into software development and programming. And for me, companies like LG, Samsung, and ST, which includes product development. So they kind of include a whole product development, electronics, consumer electronic products. And it so happened basically that there was a personal requirement for a device. So the very fact that cardiac diseases are #1 killer across the world is basically what we saw firsthand when it actually hit in our family. So about 2012, I think my father was detected with cardiac disease, and luckily we got him admitted in Apollo Hospital, Delhi, and everything went fine. But there was a bold underlined cautious line given to us by doctors that if there is a chest pain, then you don't ignore and get an ECG done.
Yeah.
So I'll also try to answer your question that why this is space. See, if there is unfortunately a cancer patient, if there is, let's say, a diabetic patient, then it's more of maintenance of that particular disease. For example, if I have diabetes or I have blood pressure, it's more of maintenance of that disease.
Yeah.
Until unless my sugar is very low or very high, I can still cope up. Same goes with cancer also. It's more of a detection and then maintenance of that particular disease. But in cardiac, what happens is that you have just 1 or 2 hours. So if somebody is having a cardiac event, which could be a heart attack, golden hour is 1 hour on the onset of symptoms.
Yeah.
So if you get a doctor help, or even if you get diagnosed that it's a cardiac event in just 1 hour, then it's like 80% chances that your life will be saved and you will not be probably needing an operation as well. But what happens is that this particular chest pain is very similar to other pains like gastric trouble or muscular pain. So what happens is that people, first of all, cannot diagnose it on their own. So if I have a temperature, I'll use a thermometer and I'll diagnose that I have a fever. If I am feeling blood pressure, I have a device, blood pressure device, I'll go and measure. But for cardiac, there is no device. Only way is to go to a hospital, lie down, they'll put about 10, 12 wires and they'll measure a full ECG report. This particular thing basically deters people to actually get this thing diagnosed because there were no mechanism available. So when it happened with our family, we started developing this thing at our home. We set up a lab in one of our rooms, started looking into it. And we achieved about 10%, 12% of this thing in about 8 to 10 months. And because it was so challenging and we always like to face challenges and all, plus it was very much a requirement, not only for us globally. So we decided to quit our job, do this full time, and we spent, I think, good about 3 to 4 years just on the research of how to develop this thing. And after 4 years, we were able to develop self-use device which just by touch can actually give you the same kind of data that you get in a hospital. And getting that report is not the end. Getting that report is just 50%. 50% is now you have to show to a cardiologist and get diagnosed. So then eventually we also developed our software layers, algorithms layer, AI layers, where part of the job is diagnosed by AI and algorithms. And then that particular data is actually given to cardiologist to help him understand that ECG in a shorter span of time. And so this whole 3 to 4 hour job of finding a lab or a hospital, getting this ECG, reviewing it by cardiologist was squeezed in about 10 minutes. So because it was such a eminent kind of thing, so we had to actually quit our jobs and then get into this. And definitely this whole journey has been very exciting, not only for us, but for our team as well.
No, this sounds very interesting, but Neha, I'll come to you. If you can tell us, first of all, is it a first of its kind device in the world? And if it's so, then, I mean, having a device or, something like ECG, which perhaps hasn't been there in the world earlier. What was your first thinking of how you will bring this to masses? Mass adoption, how this will happen? Will that be complicated for people to operate? Will that be complicated for people to, first of all, understand, how this would work? And also the affordability factor. You had initially thought this would be limited to people who perhaps are, who understands technology, or also to the people who are, in the tier 3, tier 4 towns, who perhaps are not aware of such devices. How that thought process went?
Sure. So as Rahul said, we started with not an idea that we want to make an ECG device per se. We wanted a tool where each and every person can detect and monitor their heart health, which was not there till then. And even today, there are not many devices like that. Yeah. So we just wanted to make a tool which, like a blood pressure monitor or a blood glucose monitor, which anybody can use and can monitor their cardiac health. Now, when we started researching, it came out that ECG is the first and the gold standard of diagnosing and detecting any problem in heart, and that is the first step. So obviously we have to work on ECG. Now, ECG is a very complicated process. It's like the principle is very simple, but it's a very complicated process. Till date, the hospital machines are very cumbersome. The person has to lie down, a lot of wires are attached to the body, and then the graph comes on the monitor, and then a paper report is given. It is shown to the doctor, so long queues for the doctor appointment, and then the doctor sees, because there's no number like blood pressure or blood sugar. The doctor sees and interprets whether there's a problem or not, and then there are very few expert doctors who can actually read and interpret the ECG. So we wanted to ease out the whole process, because if we wanted each and every household to have this tool, then it could not be complete. Now, today when we talk about ECG, there are a lot of people wanting to ride the wave of ECG. They're just wanting to digitize the ECG or making it portable, or but nobody has ever thought of making it easier for the person or even the doctor to use it. So that was the whole premise, that was the whole thought process, that why it should be touch based, why it should be pocket size, so that anybody can keep it in their pocket, in their purse, in their bags, and carry it anywhere. And also it should be connected, because if a person gets an ECG, it's of no use. So it should be connected to a doctor. The person should be able to connect to a doctor and get a quick review and get a quick consultation. So we had to connect all these dots, and that's how we researching, and we had to simplify the whole process of taking the ECG, and that's where our patent and our IP lies. Then affordability factor, very important. And also, when we wanted to make it for masses, definitely it had to be most easy to use, super easy to use. And also it should be as easy as taking a picture or sending an email. Now, when we started, smartphones were inventing in the world and in India also, and internet was making room, and even in the remotest corners. So we just made use of that technology, and we thought that instead of big monitors or why give paper reports, we connected it to the mobile. And even when we started, the smartphones were as low in cost as 5,000, 6,000 INR. So many people could afford it. Many people right now, they're even lesser. So it was it was easier to make it accessible for everyone. And obviously, because it's an Indian technology, we were manufacturing it. We were holding the rights of it, like the IP and the technology. We could make it very affordable. So that's how we connected all the dots, like affordability, technology, ease of use, and also the accuracy.
I'm sure, I think more than 2 lakh ECGs, if I'm not sure, have been conducted through the devices, if I have got the figure right. When you go to the doctors, the B2B collaborations that you do, what have been the initial thoughts, when you went to on the B2B side, they already have these devices, these large machines. I'm sure the cost benefit is certainly there. But what was their reaction when you first went to them?
Basically, it was the doctors who actually motivated us and at every step. So when we had a prototype, we showed it to doctors.
Okay.
It is the doctors who actually asked us to leave our jobs and get this, because it was just, I think, 12% done, because it was just single lead at that time. Do it for 12 lead. Doctors were our first customer.
Yeah.
Our first ever customer was doctor. On digital side, when we came on Amazon, and so that was a doctor. And till date, whenever other people, they show our device to doctors basically and all, they just they just praise this whole technology, this whole thought basically of doing this. And they are very happy to see this, and they always come up with different ideas basically, which is very good. So when they come up with the ideas, we actually discuss with them, try to improve our technology or the app or the whole some business process. So I think from day one, and I can name that doctor also, Dr. Kamal Ahmed Khan from Apollo Hospital, Jasola. He was the first doctor who actually we showed our device to him, and he is an excellent doctor, and he gave us so many ideas and all and everything. And like him, there were so many doctors. So now we have Dr. Ramakant Panda, Asian Art Institute founder, who is using it. Dr. Tejas Patel, who is living legend, like 25 safest hands in India. And I can name so many such doctors who are actually using our device and referring our devices to patients. So I think we are very grateful to doctors for always motivating us and helping us.
No,
doctors are not a threat per se. They have different use cases for the device. So it's not, you're not seeing it as a threat or, something which is cutting them off. It's actually, they are actually seeing it as a device where they can provide better care to the patient. So, if they can, they're able to.
Yeah, I'll name few sentences that doctors have said. So doctors themselves, so you guys have invented a stethoscope for heart. So they think it like this. So they are very happy. They think that it is augmenting their practice. It is augmenting their care for their patients. So that is why they are very happy.
Mm-hmm. And have you heard from these large companies making ECG machines? Have you heard from them or have you partnered with them? I mean, in any way, any interaction that you have with these large corporations?
So basically, no, they don't come on into our roadmap. So though there have been discussions and we have, but they never come in our roadmap because we don't
Mm.
want to get installed in a hospital.
Yeah.
We want to be present in every household in India. So we are happy to make them limited to the hospital, and we are very happy to serve 100 crore people, 140 crore people in India. And instead, like our partnerships are with different companies
Mm.
who are actually who can basically help us achieve this roadmap.
Okay. I remember this thing vaguely. I think last year there was this instance where this Apple Watch was able to save a person's life because it kind of, it kind of alerted the person about the challenge that Hurt was having. Your move getting into the watch, smartwatch, does it, I mean, what does it mean? You want to put the ECG into the smartwatch? And if so, then how would you keep the ECG device separate and the smartwatch separate?
So basically, the thing is, we have been pioneers in ECG. We were even Apple came after us in terms of a product, basically, or including it in a product. We were the
Yeah.
first to basically get it done in India in a
Mm.
product into a consumer electronic product which normal people can use. Now, if Apple is doing it just with ECG,
Yeah.
so, and because we have a longer history than Apple on this
Mm.
particular technology, and we have invented different devices with multiple parameters also. So when we were doing touch-based sugar, when we were doing touch-based blood pressure, blood oxygen, and
Mm.
also ECG, we were kind of looking into a very holistic view of a person's health. So it was not just an isolated ECG. So I'll give an use example also what happened. There was a guy with a high blood pressure, and he didn't reveal it to anybody.
Okay.
When we did ECG, the ECG was very deadly. So when we digged into the matter, doctors came in. We got to know that that guy is a BP patient. He has not taken his medicine. So that is why this thing is getting reflected in ECG,
Mm.
and he might have an heart attack. And subsequently, he may die also with heart attack. So
Mm.
people will always think that he died from heart attack. Actual cause was blood pressure.
Mm.
Because
Mm.
we have technology on ECG, we have technology on BP, we have technology on sugar,
Mm.
blood oxygen. Now our smartwatch will
Mm.
basically combine all these parameters,
Also,
unlike any other smartwatch in the world,
yeah.
and then it will present certain parameters, certain results that that will really help a consumer, that will really help a healthcare provider,
Mm.
because it will go beyond ECG. It will go just beyond BP. It will go just beyond sugar. It's going to combine this into a holistic thing.
Would we see doctors getting the smartwatch more than the ECG for diagnosing?
See, doctors would always love devices which can give accurate data.
Yeah, yeah, yeah.
As we all know, that even the so-called biggest player in India on smart watches and all, I'm not
Yeah,
naming Apple because Apple is, we really respect Apple in their technology and
yeah.
whatever they have contributed to the community. They are
Mm.
kind of our role models, our ideas. But I'm commenting on the rest of the Indian players. See, everybody is importing watches from China, and every smartwatch is giving you blood pressure. They're giving you even ECG. So
Mm.
they are just making fun of health data,
Yeah,
and actually they're playing with a lot of lives as well.
sure.
And that's why doctor really hate these kind of devices. So it was. I'll tell you what happened is Prime Minister Narendra Modi came to our stall, and I think Neha would, because Neha met. So I think Neha, can you please, how Mr. Modi actually motivated us to do this? I think Neha would better explain.
When did this happen?
Yeah,
Yeah, so
Neha will explain.
I met Mr. Modi in June. He was a part of Lucknow UP Investors Summit,
June
and
this year.
UP, yeah, in Lucknow.
June, yeah.
So, we were present there. Only 11 startups of UP were invited, and we were there. And it somehow just happened that I had to show the product to Mr. Modi, and I just went there and showed, like, this is the smallest ECG, and we're making it in India. It's a complete Indian product, and he got very intrigued. Like, he is a very like a high intellect person, but obviously he's very aware person. So the first question he asked me is like कि ये तो इसमें watch में भी आ गया है, तो your device is still a pocket device. So and then he said, where are you manufacturing it? So when I said that our manufacturing unit is in Noida, so he was very interested. And when I said that we are moving into watches segment also, but ours is something which even the doctors are using. It's not just a fad or a fashion device, like, because everyone is having smartwatch. So like we are also venturing into it. Ours is a more medically inclined and researched product. So he motivated us well, and his eyes were lit when I said that we are manufacturing them in Noida. So yeah, it was a great meeting. So yes, so the thing is that we have technology. We are not venturing into, we are not riding the way that because everyone is into watches, so let's make watch. We have technology. We made the technology first. We have validated the technology first. We have medical fraternity on our side, trusting our technology, using our technology, wowing from the kind of data that our mini devices give. So we are now integrating it into a watch, so that because watch is easier to wear and take it anywhere, and it's not it doesn't interfere into your daily life. You can just wear and you can be on the move. So yeah, so because we have the technology, we can boast that now we are in a position that we can make the first made in India smartwatch, which is not there till now.
So ECG, I mean, because it was first of its kind, I think relatively it was more easier for the company, to position itself in the market because it was first of its kind and on the go ECG device. How would you do that for the smartwatch? Because there are just multiple smartwatches in the country, and how would you actually make people aware and know, why Bharat smartwatch is better or probably unique than other smartwatches, because the market is flooded.
Yeah. So basically, I think it's like, Geo made internet accessible to each and every household. So we are having the same intention and vision, making health devices. And it's not just smartwatch, it's really core, focused on health. So we would be we would be making it them so affordable that it would be accessible to each household with the quality data. So it would be a meaningful data which the doctors would trust. So it's also very important because we have a backing of our certifications and whatever we are going for FDA also. So we have that backing. So position is definitely not difficult because market is flooded, but then whoever gives more value is always appreciated.
And when we say so many ECG devices have been sold, the bottom line, do you have a number? How many lives SanketLife has been able to save so far?
See, many lives. I think each and every life which SanketLife is touching, I think it's not that every time a panic situation will be there and then the life would be saved. We call it a life saved. Even everybody who's monitoring their heart and getting an indication that this is the time to rush to the doctor, the life saved, right? There are so many doctors who are using it for their patients, so definitely those lives are touched. But apart from that, we have many stories where actually, like in pandemic, when people were scared to go to hospitals and doctors for checkup, when there was a lockdown and everything. And we have a story where a person had chest pain and he was reluctant to go for a checkup. He said, "Theek ho jayega," and there's nothing serious. And a doctor was his neighbor who happened to have our device, and he said, "Let me check. It's okay, and we'll check. And if there's something wrong, we'll go to the hospital." And there was indeed, he was indeed having a problem in his heart. And then they rushed to the hospital, and his angiography was done. So there, and then there's also one story where a doctor had to fit a pacemaker into women's heart, and used our device to constantly monitor his heart, and because he was in a very remote area, so no infrastructure was there, like no machines and remote monitoring devices. So he used our machine. He also did good press release and everything because the life was saved. So there are many stories like this. Pandemic, lots and lots of stories we got there. People who were reluctant to go to hospitals for checkup, they kept a check on their heart with our devices, and their problem was solved, or they connected with the doctor with their report, and doctor suggested them some medicines or whatever if there was some problem, or even if they had to rush to hospital.
We'll move to the last question, Rahul. So what's next after SanketLife? What new products and what more countries we are looking this to be expanded to in the current FI? And also if you can share some figures around the business growth, the revenue expectations, customer expectations.
Yeah, so basically we've got very good response from GCC, from Africa, and we already started business with them. Secondly, after this particular device, we are kind of always innovating different things. So we've already shared the news about the Bharat smartwatch. In Q4, we will probably share another blockbuster device, which is again one of its kind in whole world.
Okay.
That will be again a D2C product, and we're still working on that. So once it reaches to a point that we can actually share it with you, we'll be very happy to share it with you. But definitely that particular product is, I think, 2 steps beyond the smartwatch, and it's going to create its own vertical. So we are working very hard on that. And yeah, in terms of growth, our target is basically to maintain about a 10x growth in this financial year compared to what we had.
Yeah.
And also offer our consumers simpler ways basically to buy our device and then use our device. So we are working on making things even simpler. Already this whole process of ECG and getting it reviewed, we have already simplified it. Now we're kind of working on how to make this whole buying process also very simple. So we're working with different banks and all to come up with different things. Probably around Diwali, I think we'll be able to roll that out for our users.
Great. Any parting thoughts from Neha?
I think, it's a very exciting journey, and we are really enjoying, and we're really, happy that the products that we conceptualized, and we did not even know that, if these products would work or not, whether anybody would buy or not, but we only had one thought in our mind, that if they worked, and if because doctors were biggest stakeholders, so if doctors believe, then they could save lives. And today we are seeing those stories and those things happening around the country, and we are present pan India. So from remotest corners of the country, we hear stories from army people, from mines, ONGC people, and even in the villages and many remote areas. So it's really the thought that we had that people should not die because of cardiac diseases. That dream is looking to come true. There's a lot of work to be done, but yeah, we are really enjoying it.
Thanks, Rahul. Thanks, Neha, for joining us today once again. And thank you, viewers. Please do share your feedback and also suggestions if you have similar stories to share with us. We'll be back with another exciting video very soon.